welcome back to my channel. So today I just want to show you guys pretty much everything that I'm using for my recovery. A lot of these things are items that you can use pre-surgery and post-surgery, and to be honest, I actually got a lot of these things before my surgery because, as you know, you have to prepare for that. I'm gonna go through everything that I have here. I know it kind of looks like a lot, but like I said, you're actually gonna go through different stages throughout your recovery and you're gonna need different things. I feel like I just kind of learned things as I went along and I picked up what I needed. So they really helped me in terms of my recovery at home because I go to physio once or twice a week. So I mean, for the most part, we're doing the majority of the work on our own when we're at home. Let's start with vitamins. So this is the Organica. This is a premium Ligajoint pill. So I take 2 in the morning, I take 2 in the evening. It's for cartilage health. There's 180 capsules in this, and so this lasts for a pretty long time. I would definitely recommend this. I got these off of Amazon, but you can probably find them in your local health store as well. This ice pack right here, it's lined in cloth like this felt, and it has ice inside of it, and then you can just wrap it around your knee. I love it because it's really light and it's easy to put on, and you just wrap it around so you have that compression as well. It's really light, can easily walk around with it. Definitely wear these on your bare skin. I'll just show my other ice packs. So this is Flexi Cold. So I got this off Amazon. Oh sorry, I got that off Amazon. I think most of these items are from Amazon, to be honest. So I got one of these. I think I showed this in my first video. I'm not sure, but I know I showed this one. This is the same brand, but it's just a giant one. So you can use any kind of stretchy band that you have, and you just kind of like wrap it around your knee, and that's that. And the other one works the same way. And what I like about the other one is that it gets all the way behind. Like, you just need something stretchy. I like this thing that I have because it attaches with Velcro. But yeah, you could use like this kind of bandage. You probably have this from after your surgery, so you can use that as well. Continuing with ice, I actually ended up buying this recently because with ice packs, you have to constantly put them into the freezer. You know, someone always has to get it for you, or you have to go to the freezer and get it out yourself. And honestly, it's just kind of a headache. So I went ahead and I bought the Cryo Cuff. Basically, it's like this giant thermos that you fill up with ice, and this cuff wraps around your knee. I'll show you guys a little hack. So you're supposed to fill it up with ice, but that's kind of a headache too. What you do is you just get a couple bottles of water, you freeze them. It takes about 3 of these. So you just pop them in. It will last pretty much the whole day. What I do is I actually have 2 sets. So I have one in here and I have one in the freezer, and then I'll alternate. This literally was life-changing because I could just have this on the side of the bed, take this wherever I am in the house, and it's ready to go. This one's actually, it works through gravity. So what you do is you put the cup on, like so. Okay. You want this to be higher than the cup, so the water is going to run down and fill the cup. Once it's full, you just detach, and that's it. It stays cold. You leave it on for 20 minutes, and then when you're done, you just plug it back in and all the water will run down. It's portable. If I have an appointment, I can actually take it with me. If someone else is driving, I can bring it into the car. And like I said, you don't have to keep getting up every 2 seconds to get ice. Because you know, in the beginning, you're icing all the time. It's really important to make sure that you're on top of your ice because you don't want that scar tissue to develop, right? So this is a roller. What you do is you basically roll your muscles, all this soft tissue here. This is really tight, especially after surgery, and you're gonna need this throughout your recovery. So you're just gonna roll. You wanna break this all up here. Really wanna make sure that everything stays soft. You get out all these knots. It's really sore. So you do what you can. So I do this once a day, and it's really important. So I got this off Amazon as well. Okay, so this is a thumper. I had this before I was injured. It has 5 different levels. It just kind of vibrates, and you can just go run this down your leg. I avoid this area for now, kind of stop here, just because everything's still healing and I don't want to aggravate the graft or anything like that. So I try to do this once or twice a day. I have 2. So I keep one by the couch and I keep one by my bed. I do it first thing in the morning before I even get out of bed, and just kind of gets all the circulation going, gets all the lymph moving. So when I actually get out of bed, it doesn't feel so stiff, and it just feels better. So this is a heat pad. Plug the heat pad in, and it has different levels. So I always put it up to the max, and it also has a timer. Literally, when I'm just sitting there watching TV, I'll just wrap, let's see, I'll just kind of like wrap it around like so. And it actually really gets warm. And then after that, what I like to do is go straight into my bending. So my surgeon actually recommended this for me because my knee is a little stiff. So he recommended that I try heat. So I was actually applying only to the back, and he basically recommended that I apply it to the front as well, or just wrap it all around and then go into my bends. And I feel like this has really helped. So this is something that I highly recommend. I know for myself, my body does respond really well to heat. I like to have it on if I'm watching TV, and it just, I don't know, it's just really cool to have. I wish it was like bigger, but the only downfall is if you put this on and you're watching TV, sometimes you don't want to get up. But this, oh my god, this is so fuzzy. I've had this. So when I first got injured, I bought these. So I have another one. It's basically just a sleeve. So you just, you know, put it on. It just kind of compresses your knee. I'm not wearing it this second, but I have to keep my brace on all the time. So I like to have this on underneath my brace, especially if I'm wearing shorts, because it's just really uncomfortable. And this also helps with the compression, which we need. So this is a band. So I'm not using this right now, but eventually I'm going to use this to exercise. I'm going to wrap it around right above my knees, and I can use this to work my abductor. You can also stand up and use this for kickbacks and side leg lifts. So I got a pack from Amazon, and it comes, I think it came with 3 bands, and they're all different colors. There's a blue and green. This one I think is the hardest one. And yeah, you can just, so you know, you can work your way up, but these are just really cool to have, and you can use these after to work out. I actually had these before I was injured, and I was using them to exercise, so highly recommend some bands like this. When you're trying to bend your leg, you just need like something like this to kind of attach to your foot, and then, you know, when you're laying on the ground and you kind of pull it in, I use this to wrap around my foot and do my bends. So you're gonna need something like this. I got this from the dollar store, fairly easy to find. This is the Dr. Ho TENS machine. So this is really important. So this is gonna increase your circulation, blood flow to the area. I use this a couple times a day. It's really gonna help with your mind to muscle connection. It has, you can't really see it here, but it has 3 different modes, and it also has a timer, and it has different levels. So this is also good for pain. I know for myself, I have a lot of pain in here. So I put the pads here and I just put it on a really low setting. It really does help alleviate the pain. Sometimes I also use this when I'm doing my exercises, especially with my bends and when I use my bike. Yeah, I'll show you the bike in a second. This just helps to get the blood moving more. It really gives your muscles that pump that you need. After surgery, especially, that connection is not really there, and there's still a lot of swelling and things going on, so it's kind of hard for your muscles to get a lot of blood flow and circulation. So this is going to help you with that. So I highly recommend. This is a set. It comes with more things. It also comes with a foot connection, so you put these pads on the ground and it will actually give you like almost like a foot massage. So that will also help with your lymphatic drainage. So this is something that I actually had before the surgery. I was using this for massage. I don't know if you've heard of cupping before. It's really popular. I actually saw a doctor use this on YouTube, and so I remembered I had it, and I was like, you know what, I'm going to use this. So what I do is I just kind of apply it in oil to the area, and very, very, very lightly I put the suction on. I cup around my knee, obviously not where any of my stitches are right now, but just kind of around everywhere, and this helps to kind of lift the skin and help with the circulation, because with massage you're pushing down. So with this, it's a little different. It's kind of pulling everything up. It increases blood flow. It comes with different sizes. You can use this pretty much everywhere your back. It's really good for like the IT band. I'd recommend this, so yeah. This is something that I had before I was injured because I like to work out at home. So I like to have different things that I can use. This is the Thigh Master. I'm not going to use this right now because I am really sore, but in a couple weeks I think I'll be able to use this. Basically put it in here and you push in. So this is really going to work your adductor muscles, which is your inner thigh muscles. I have to strengthen my inner thighs. That's really important. So that's that. So when I go to physio, my physiotherapist has something called a Graston. So it's this little metal tool, and she basically puts like that gel. She kind of scrapes around my knee. It's supposed to break up the scar tissue. So what she said is at home I can just use like a butter knife and, you know, put some oil and just gently scrape around my knee, all around here, and just really try to break up that scar tissue. So I just put this stuff in a Ziploc bag, and it's basically just my baby oil. I have my little knife. Something that my surgeon just recommended, Voltaire Gel. You can get this at your local pharmacy, and it's basically an anti-inflammatory cream. He told me to just massage all around the knee, the patella, and the back as well. Helps with inflammation. This is a foam roller. This is the basic one that's just flat here. They also have other advanced ones that are actually bumpy, or they have like kind of spikes on them. But for now I just got this. I'm going to be using this soon to kind of roll everything. So this is going to be really important in terms of breaking up like just all this scar tissue that's here and all this tightness. You can roll your quads, your hamstrings, your back. It's amazing for your back. You can also do your calves, and it's just amazing. This is basically like equivalent to getting a massage. My chiropractor recommended this for me. She said that I really need it, maybe not right now, but in a couple weeks, just because I'm really sore right now. It will be really uncomfortable. So this is something that you can keep in your home gym. My chiropractor actually told me that she uses this every day after she exercises, before she stretches. Helps alleviate any pain, especially back pain. I am looking forward to this. So this was from Amazon. It's Amazon Basics. I will link this below. This feels amazing. So this right here, you guys, is a mini peddler, and it's just a little, you know, mini bike. I do this for about 15 minutes a day, and you can adjust your chair and just go back. You can set like the timer, and there's also this like little knob here, and you can adjust the tension with that. I actually use this with the Dr. Ho, and I attach the pads. I put 2 here and then 2 on my hamstrings. Keep it on a very low setting, and I just pedal for 15 minutes, and that gives my muscles more of a pump. Highly, highly, highly recommend it. So my surgeon actually recommended this. You put your foot up on the skateboard and use the other foot to push it back. So this is a very passive movement. I'm using my other foot to move the skateboard. You know, you can do this while you watch TV, and you just kind of rock back and forth like that. And then eventually, you know, you'll get more and more flexion. Incorporate things that you're actually going to use. You know, you can have this in your living room. Same with the mini peddler, and you can just have it in front of your TV. So when you're watching TV, you're actually doing something. You want to keep that circulation going because you don't want that scar tissue to form. It feels really swollen, so I do have to go and elevate it right now and ice it. Okay, so guys, that's basically everything that I have been using. All the stuff's really important. It might seem like a lot. If I can help anyone out there that's kind of struggling in terms of what to use at home, because I know it's a lot. It is overwhelming, and I don't feel like anyone really fully prepares you. You do have to continuously work on your flexion, your extension, your circulation, your icing, and everything like that. And another thing is just like a tip is I set timers on my phone. So I try to bend every hour. It doesn't always happen, but I try to bend for a couple minutes every hour. And things like ice, I do time that. So right now I'm icing every half an hour to every hour, and it's really easy with the Cryo Cuff because it's right there. So just try to make things easier for yourself. Try to keep things accessible, and just try to stay strong, and just know that you're gonna get through this. A lot of these items you can actually use after your recovery if you're working out at home. So that's a bonus. So that's about everything. If you guys enjoyed this video, let me know if you have any comments below. If there's something that you recommend, something that has helped you with your journey, and I will see you guys next time.